The topic of lecture: dental caries, etiology and pathogenesis. And first, definition of caries. What caries is? Caries is localized pathological process that occurs after the eruption of the tooth under the influence of microorganisms characterized by the demineralization of calcified tooth tissue and the disintegration of the organic matrix followed by cavity formation. And there are some indices of caries. First is prevalence. This is percentage of persons who have one caries cavity, a seal or removed tooth. It may be caries, it may be seal or filling, and removed extracted tooth, which was extracted before, or absence tooth. The second index is intensity. In Russia, we call them KPU. This is the sum of caries, letter C, filled, letter F, and removed, letter R, teeth in exactly one patient. And morbidity, the third index, is morbidity. This is increase in caries and its intensity, or average number of new teeth affected by caries, which are determined over a certain period of time, for example 1 year. 3 indices of caries: prevalence, intensity, and morbidity. And as for etiology of caries, caries is multifactorial process. The development of caries is based on microbiological theory. The main etiological factor of caries is the microflora of the oral cavity. And there is some scheme of etiology. Caries is multifactorial process which is under influence of some factors: tooth and its quality, some sugar, and the main etiological factor is bacteria, exactly Streptococcus mutans. And of course it's time. Multifactorial process. And as for etiological factors, there are two big groups of factors. First group is general cariogenetic factor, and local. General factors are defective diet and drinking water, dental caries resistance, some somatic disease, and stress. And local etiological caries cariogenic factors. There are plaque, dental plaque, the violation of the properties and composition of oral fluid, and carbohydrate food, some sugar. Also, defective structure of teeth, enamel, and genetic factors. The main cariogenic bacteria. Main reason of caries is bacteria, and especially group of bacteria which are called Streptococcus, and kind of Streptococcus, Streptococcus mutans, Streptococcus salivarius, Streptococcus mitis, and Streptococcus sanguis. All of them may cause caries. Under its action or under its activity, caries appear and develops in teeth. Streptococcus, caries causing bacteria. Properties of cariesogenic microorganisms. Why they may cause caries? First of all, formation of polysaccharides from food sugar. The second point, formation of organic acids. And the last one, also adhesion to dental surface. Bacteria, exactly Streptococcus, may form some polysaccharides from sugar, also form organic acid and adhesion to dental surface. Also, scheme of development of caries. Tooth and dental plaque, sugar and acid. From sugar there is acid due to activity of bacteria, of microorganisms. Dental plaque and its role, its influence in caries development, caries appearance. Dental plaque is a specific formation on the enamel surface in the form of a cluster of soft bacterial deposits. And localization of plaque, special localization, fissure, contact surfaces, interdental spaces, and cervical area of the tooth. Special places for localization of dental plaque. Early dental plaque. Dental plaque may be early. This is early stage of dental plaque. This is organized structure which consists of colonies of microorganisms, extracellular polysaccharides, epithelial cells, leukocytes, and some other cells like macrophages and some other eosinophils. And mature dental plaque, the next stage of plaque is matured dental plaque. This is composition of the later mature plaque, which consists of the same microorganism and also mineral components, also proteins, enzymes, extracellular polysaccharides, epithelial cells, and so on. The main difference between previous early plaque, this is mineral components. Mature dental plaque consists of the same components, but mineral components is the difference. As for polysaccharides, they provide adhesion of dental plaque to the hard tissue of the tooth and create a matrix of plaque. And they are an energy reserve for the microflora of the oral cavity. The role of nutrition in dental etiology, the role of food. Monosaccharides like glucose, fructose, lactose, kexose, and especially D-saccharides like sucrose. This is glucose plus fructose. And also polysaccharides like starch. And the most carcinogenic potential of various carbohydrates, there is sucrose, the most aggressive carbohydrate, and other glucose, fructose, starch, less aggressive, the most dangerous sugar is sucrose. Influence protein nutrition like amino acids, lysine and arginine can contribute to caries, and important macro and micro elements. This is calcium, magnesium, vanadium, molybdenum, and especially fluoride. This is important element in food. And as for modern concept of dental caries, generally recognized mechanism of caries in the progressive demineralization of hard tooth tissue under the action of organic acids and the formation of which is associated with the activity of microorganism. So microorganism is the main reason of caries. Under its influence, caries cause in the teeth. The etiological factor of caries is the microflora bacteria of the oral cavity, like Streptococcus mutans, mitis, sanguis, salivarius, lactis, and other, which creates colonies in the form of dental plaque or dental plaque and possesses two properties like ability to form extra or intracellular polysaccharides and acids. So main etiological factor caries and its ability produce acids from polysaccharides. And there is scheme of pathogenesis of dental caries. Dental plaque plus sugar equal acid under the influence of bacteria from sugar, and bacteria that are in the dental plaque, there is acid. Bacteria produce from sugar acid. So acid, under the influence the acid, the enamel of tooth becomes weaker and destroyed, and there is caries. Some very simple scheme of pathogenesis. First, dental plaque and bacteria plus sugar is acid, acid plus enamel is caries. And also scheme: diet with sugar plus diseases, somatic diseases, and bad hygiene. This is additional factors of caries for the development of caries. And due to bacteria activity from sugar and sweet food, there is organic acid, which is plus enamel cause demineralization. And opposite process, opposite to demineralization, there is remineralization. This is some repair of enamel due to good hygiene and some minerals from oral liquid. Remineralization is good process for enamel, and demineralization is bad process due to there is caries cavity appear, develops. Normally, the demineralization phase is constantly and consistently replaced by a phase of remineralization. Two opposite processes. Remineralization means recovery. Provided that sufficient intake of calcium, phosphorus, and fluorine from the food and saliva to the enamel is obtained. This is first process of demineralization. This is acid. This is enamel prisms, and some microelements leave the enamel. So destruction of enamel and caries cavity. And opposite process: from saliva, elements, mineral elements, go to enamel, inside enamel, making it stronger. Demineralization, remineralization. Due to demineralization we have caries, and sometimes due to remineralization it may recover some spotting caries, not cavity, just spotting caries may recover itself due to calcium from saliva. At an ion concentration of pH which is 5.5 and below, this solution of the enamel begins. This is curve of Stefan. Below pH below 5.5, demineralization, this solution of enamel. Graphically, the changes in pH in dental plaque when exposed to sugar is depicted as a Stefan curve. The role of saliva in the caries etiology: maintaining acid-base balance in the oral cavity and restoring the hydrogen index is due to the activation of the proteolytic microflora as well as through the gingival fluid and buffer system of saliva, protein buffer system, phosphate, and other. Saliva has a protective effect on caries, that is, surfaces washed with saliva are less affected by caries. The amount of saliva is inversely related to caries and the viscosity is directly proportional to caries. An important role is played by the enzymatic activity of saliva, alkaline, phosphate, lysozyme, etc. And the composition of the enamel, namely the displacement of calcium phosphorus ratio 1.3 and normally it's 1.67 is characteristic of caries. A high level of fluoride composition 1 milligram per liter in drinking water and above leads to the formation in the surface layer of fluoride, calcium and phosphoricum and fluoride, the most resistant to acid.